Okay, welcome back. In this video, we will continue our series on medical terminology. In this video, we'll discuss chapter number 10, the digestive system. Learning objectives for this chapter. Define and spell the word parts used to create terms for the digestive system. Break down and define common medical terms used for symptoms, diseases, disorders, procedures, treatments, and devices associated with the system. Build medical terms from the word parts associated with the system. And lastly, pronounce and spell common medical terms associated with the digestive system. First, we'll mention some common word parts that you'll see. The first one, abdomino, is a reference to the abdomen. Ano is a reference to the anus. Appendo or appendico is a reference to the appendix. Bili is a reference to bile. And ceco is a reference to the cecum, which is the very first part of the large intestine. Col is also a reference to the bile. Corlidoco is a reference to the common bile duct. Colo or colono is a reference to the colon. Cyst or cysto is a reference to a sac of fluid or the urinary bladder or a cyst in general. Dento is a reference to teeth. And our last term here, duodenum, is a reference to the duodenum, which is a section of the small intestine. Entero is a reference to the intestines in general, but usually the small intestine. Esophago is reference to the esophagus. Gastro is reference to the stomach. Gingivo is reference to the gums. And glosso is reference to the tongue. Hepato is reference to the liver. Ilio is reference to the ileum, which is the last section of the small intestine. Jejuno is reference to the jejunum, which is the second section of the small intestine. Linguo, also a reference to the tongue. And oro is a reference to the mouth. Pancreato is a reference to the pancreas. Pepso or pepto is a reference to digestion in general. Peritoneo is a reference to the peritoneum. Procto is a reference to the rectum and the anus. And pyloro is a reference to the pylorus or the pyloric sphincter. Recto is a reference to the rectum. Cialo is a reference to saliva. Sigmo is a reference to the sigmoid colon. And stomato is a reference to the mouth. Alright, now we'll talk about some basic anatomy of the digestive system. And, the whole point of the digestive system is to convert the food that you eat into a form that your cells can naturally use, for energy, for growth, and repair. And how well the system functions are dependent a lot on accessory organs that will contribute to the digestive process. And this is done by secreting enzymes and other chemicals into the gastrointestinal tract. Now, the gastrointestinal tract, or GI tract, as it's often abbreviated, consists of the following. Start with the mouth, and the pharynx, which is the throat, the esophagus, which is the tube that leads from the mouth to the stomach, of course the stomach, and then you have the small intestine, the various parts of the small intestine, duodenum, jejunum, and ileum. And from there you go to the large intestine. The first part is the cecum, then the colon in general, its various parts, and of course the last part would be the rectum. There is a very general overview of the system, starting with the mouth, the throat or the pharynx, then the esophagus, into the stomach. That lead to the various parts of the small intestine, and then the large intestine, and then out through the rectum. As I mentioned before, the accessory organs to the system are critically important to its overall function, and those accessory organs include the salivary glands in the mouth, the liver, the gallbladder, and the pancreas. Alright, now we'll talk about some pathophysiology with the system. Now, the digestive system is under a constant risk of infection, basically because the entire GI tract is one long open tube to the external environment. So from your mouth down to the esophagus, to the stomach, the intestines, all the way out through the rectum, is all one continuous open space. So it is under a constant risk of infection. Now, the GI tract is normally home to a very large number of bacteria called the digestive flora. For the most part, these bacteria are very, very helpful. They increase your digestive function. They help you absorb certain vitamins that you normally wouldn't if they weren't there. But if this flora is allowed to increase in density or spreads to other parts of the body, this can lead to very severe infections. Now, the organs of the GI tract are also susceptible to inherited defects, or to the development of tumors. And some examples of some specialists that you may need to see if you have issues with this tract or with this body system will be head and neck specialists. If you had a problem with your tongue or the salivary glands or the esophagus, or a gastroenterologist. And that specialty would deal with the stomach and then the intestines in general. Proctologist, of course, would focus on the rectum and the anus. Hepatobiliary specialist, this person would deal with the liver and the gallbladder. Oncologist, dealing with cancer in general. And also someone who studies internal medicine. This could cover a wide range of issues, going from the intestines to the pancreas to the liver or gallbladder. So some of these specialties are going to be more general, others are going to be more specialized within the system. All right, now we'll talk about some signs and symptoms and their common word parts. We'll start with the prefixes. The first one, A, it means lacking or without. Dia means complete or through. Dis is painful or abnormal or difficult. And then re means back or backward. All right, some common combining forms that you'll see. Bili is a reference to the bile. Flux or fluxo, an excessive amount of discharge or an excessive amount of flow. Gastro is a reference to the stomach. Halato will be a reference to breath. Hemat or hemato is a reference to blood. Hepato is a reference to the liver. Pepso or pepto is a reference to digestion. Phago is a reference to eating or swallowing. Steato is a reference to fat or to sebum. All right, now I'll talk about some common suffixes you'll see with the signs and symptoms. Algia is a reference to pain. Same thing with the suffix dynia, also a reference to pain. Emesis is a reference to vomiting. And emia means of the blood. The suffix ia is a condition. Megaly is an enlargement. Osis is an abnormal condition. And our last term here, urea, is a flow or a discharge. All right, now we'll talk about some specific signs and symptoms of the system. Our first term, aphasia. This means the inability to swallow. Our next term, ascites, is a reference to the buildup of fluid within the peritoneal cavity, which will cause abdominal swelling. Constipation. This is where there is a difficulty in evacuating the bowel. This is usually because of your intestines are absorbing too much water. Okay, the opposite of that would be diarrhea. This is having very loose stools, where there's a lot more water in the stool than there normally should be. Dyspepsia, if we were to break that term down. Okay, dys means difficult or painful. Pepso means digestion. And ia means a condition. So dyspepsia is having indigestion. And the last term here, dysphagia, is having a difficulty in swallowing or a painful swallowing. Our next term, flatus. This is the buildup of gas within the stomach or the intestines, which is expelled through the rectum, also known as flatulence, the accumulation of gas within the alimentary canal. Last term here, gastrodynia. This is having pain in the stomach or a stomach ache, basically. Halitosis, same thing as having bad breath. Our next term, hematemesis. If we were to break down this term, hemato means blood, emesis means vomiting. So this term is a reference to the vomiting up of blood. Hepatomegaly, this is the abnormal enlargement of the liver. And our last term here, jaundice. This is a medical condition where you have the yellowing of the skin or of the eyes or the mucous membranes in general. And this is a good indicator that your liver is starting to fail. And here's how jaundice would look. Normally these parts of the eyes, the sclera, should be your standard white color. But with this person, their liver is starting to fail, and there's a buildup of a pigment called bilirubin, and because of that, you have a yellowish tint to the eyes. Our next term, nausea. Feeling that you are about to vomit, and that may lead you to our next term, nausea and vomiting. Not only will you have the inclination that you're going to vomit, but you actually do vomit, which is the expelling of undigested food through the mouth. Our next term, reflux. This is the backward flow of material from the stomach back up to the esophagus. A common example of that would be gastric reflux or heartburn. The material should be moving forward, not backwards. Steatorrhea is the presence of excess amounts of fats within the stool. And it's usually caused by a disease of the intestines or of the pancreas. All right, now we'll talk about some diseases and disorders and their word parts. We'll start off with the prefixes. The first one, an, means lacking or without. Dis and mal both mean difficult or painful. Some common combining forms that you'll see. Adeno is a reference to gland. Appendico is a reference to the appendix. Chilo is a reference to the lip. Col is a reference to the bile. Cholecysto is a reference to the gallbladder. Colodoco is a reference to the common bile duct. Cero is a reference to an orange or yellowish color. Colo is a reference to the colon. Diverticulo, a sac that originates from a hollow structure. Duodeno is a reference to the duodenum, the very first part of the small intestine. Entero is a reference to the intestines in general, but it's more commonly used to reference the small intestine. And esophago is a reference to the esophagus. Gastro is a reference to the stomach. Gingivo is a reference to the gums. Glosso is a reference to the tongue. Hemo is a reference to the blood. Hepato is a reference to the liver. And lipo is a reference to a lipid or a fat. Litho is a reference to a stone. Orexo is a reference to a general loss of appetite. Pancreato is a reference to the pancreas. Parotid is a reference to the parotid glands. Pepto is a reference to digestion. And our last one, peritoneo, is a reference to the peritoneum. Polypo is a reference to a small growth or a polyp. Procto is a reference to the rectum or the anus. Recto is the rectum. Cielo is a reference to saliva. And volvo means to roll. Some common suffixes you'll see. Suffix al means pertaining to. The ectasis means a dilation or a widening of. The suffix ia means a condition. Iasis means a abnormal condition. And the suffix ic means pertaining to. Itis is the inflammation of. Malacia is the softening of. Megaly is the abnormal enlargement. The oid means derived from or resembling. And oma is a reference to a tumor. Osis means an abnormal condition. Pathy means disease. Penia means a deficiency. Ptosis means a drooping or a sagging. Cis means the state of or a condition. And the suffix y means a process or a condition. Alright, now we'll talk about some specific diseases and disorders of the system. So our first one, anorexia nervosa. This is having a lack or a complete loss of appetite. And this is often due to the obsessive desire to lose weight. And because the desire to lose weight is so strong, the person usually won't eat and will become incredibly thin and incredibly sick. Appendicitis, inflammation of the appendix. Bulimia, this is an emotional disorder, just like anorexia nervosa is. But with bulimia, people will binge eat and then feel guilty about eating so much, then they purge themselves. They force themselves to vomit up the food they just ate. So even though they're eating large amounts of food, the body never has time to get use of that food. So it's a compulsive overeating and then a purging, either by vomiting or by taking laxatives, or maybe both. Their next term, colitis, is the inflammation of the lips. That's related to our next term here, cheiliosis, which is a disorder of the lips, which will usually leave the person having fissures or cracks in the corners of their mouth. Cholecystitis, we're going to break down this condition. Cholecysto is a reference to the gallbladder. And of course, itis means inflammation of. So this is a reference to the inflammation of the gallbladder. Choledochitis is a reference to an inflammation of the common bile duct. Choledocholithiasis, this is a reference to having gallstones in the bile duct. And our last term, cholelithiasis, is having gallstones. See, our next term, cirrhosis. This is a chronic condition of the liver where you have a degeneration of cells. It's usually a result of hepatitis or being an alcoholic. A cleft palate. This is a congenital condition where there is a split in the roof of the mouth with a hard palate. Colitis. This is the inflammation of the colon, which is a general term for the large intestine. And this can lead to a condition called ulcerative colitis, which is a long-lasting inflammation of the colon. All right, in this example, we have a image of cirrhosis, a chronic breakdown of the liver, and then it becomes very, very thickened and will slowly lose its able to function properly. So this looks nothing like what a normal, healthy liver should look like. All right, in this illustration, we have an example of a cleft palate. You have a cleft, a space between the palate of the mouth, the hard palate of the mouth. So instead of being one continuous structure, there's a space here. Colorectal cancer is a cancer of the colon, which is the large intestine, and of the rectum. It's also known as colon cancer or rectal cancer or bowel cancer. Crohn's disease, the chronic inflammatory disease of the intestines, usually of the last part of the small intestine, the ileum, and of the colon, which can commonly lead to abdominal pain, weight loss, and malnutrition. Next term, diverticula. This is a plural form of the word diverticulum, which means a blind tube leading into a cavity, which is a reference to an abnormal sac or a pouch that develops at a weak point in the wall of the alimentary canal. And when those pouches become inflamed, that's when it's called diverticulitis. And the overall condition where these pouches develop is diverticulosis. And our last term here, a duodenal ulcer. This is an ulcer or a sore within the duodenum, which is the first part of the small intestine, the first part that branches right off of the stomach. So our next term, dysentery, is a condition where you have the inflammation of the intestines that is accompanied by having bloody diarrhea. Enteritis, the inflammation of the intestines, usually a reference to the inflammation of the small intestine. Esophagitis, the inflammation of the esophagus. And it's going to lead to our next term, esophagomalacia, which is the softening of the esophagus, which can lead to esophageal cancer, having cancer of the esophagus. Foodborne illness, this is a reference to any illness that is the result of food spoilage or having contaminated food. Our next term, gastrictasis, we're going to break down this term. Gastro is a reference to the stomach. Ectasis is an expansion or a dilation. So this condition is the expansion of the stomach. And this continues, then you get an abnormal enlargement of the stomach, which would be our last term here, gastromegaly. Gastric cancer, cancer of the stomach. Gastric ulcer, we'll be having an ulcer or a sore within the stomach. And gastritis will be the inflammation of the stomach. And more specifically, the inflammation of the lining of the stomach. Our next term, gastroenteritis. This is an inflammation of the stomach and the intestines. A very general term for the stomach flu. And depending on where the inflammation is, you may get more specific with your terms. Gastroduodenitis is inflammation of the stomach and the duodenum, so just the first part of the small intestine. And then if that inflammation spreads to the large intestine also, then you have gastroenterocolitis, which is the stomach, intestines, and the colon. Their next term, GERD, G-E-R-D, gastroesophageal reflux disease. This is a chronic disease, a chronic condition where you have stomach acid flows backwards into the esophagus, so there's a reflux of gastric juice, and over time that will eat away at the lining of the esophagus. So our next term, gastromalacia. This is the softening of the walls of the stomach. And our last term here, giardiasis. This is a reference to an infection of the intestines by a particular type of protozoan, and that infection will lead to diarrhea and abdominal cramps and bloating. It's usually found in areas that have a very poor sanitation or unsafe water. Gingivitis is an inflammation of the gums. Glossitis, which would be an inflammation of the tongue, which can lead to glossopathy, which is a disease of the tongue. And our last term here, hemorrhoids. This is a swollen vein or a group of swollen veins near the anus. Hepatitis. This is a disease that is characterized by the inflammation of the liver. And there are multiple forms of hepatitis. Our next term, hepatoma, is having cancer within the liver. And the most common type of liver cancer is our next term, HCC, hepatocellular carcinoma. It's also called malignant hepatoma. Our next two terms are references to different types of hernias. The first one, hiatal hernia, is where you have an organ, usually the stomach, that will protrude through the esophageal opening of the diaphragm. And an inguinal hernia is when you have the intestines actually will poke through or protrude through a weak spot in the abdominal muscles. Alright, this image we have an example of a hiatal hernia where you have the stomach will protrude out through the esophageal opening through the diaphragm. Zooming in a little bit closer here. Layer of tissue would be the diaphragm, and the stomach should not be going past that point. And when it does so, you have an awful lot of pain, which will also cause contents of the stomach to go into the esophagus. So you'll have gastric reflux and then usually esophagitis. So none of this should be beyond this point here. Alright, some other types of hernias. Umbilical hernia is where you have a protrusion of the abdominal cavity through the belly button. And a strangulated hernia is where you have a herniation, but the bulge that's poking out of the weak point is very, very tightly constricted. And when this happens, you're cutting off blood supply. So this is a very dangerous situation. So our next condition, IBD, inflammatory bowel disease. This is a general term for any chronic inflammatory disease of the digestive tract. Some examples of IBD would be Crohn's disease or ulcerative colitis. Intussusception. This is where you have a part of an intestine will fold over and block another part of the intestines. And our last term here, IBS, irritable bowel syndrome. This is a common disorder that affects the colon, which would be the large intestine. It's a chronic condition that has to be managed for the long term. This can include anything from pain or bloating or cramping or gas or diarrhea. Now IBD and IBS will be related, but there are some very big differences between the two. Irritable bowel syndrome is a functional disorder. So it's not one disease, but it impacts how the bowel functions. So IBS may be uncomfortable and can affect someone's quality of life, but it is not as serious as inflammatory bowel disease. Now, IBD can result in permanent damage to the digestive tract, where IBS does not. On this image, we have an example of intussusception, where you have a part of the intestine folding over to the part right next to it, which will cause a blockage, and the material it can't move forward, and this is going to get more and more painful. So our next condition, lactose intolerance. This is the inability to fully digest a particular sugar that's found in dairy products, and that sugar is lactose. Some people will have this, if they do have this sugar, will end up having cramping or diarrhea or excess gas, all because they can't effectively break down the sugar lactose. Their next term, malabsorption syndrome. This is a very general term that applies to any number of disorders where the intestines can't absorb a particular nutrient. It may be because they can't absorb proteins, or can't absorb carbohydrates, or can't absorb fats. An example of that would be our next term, celiac disease, also known as gluten sensitivity enteropathy. This is a condition that is an immune response where your body is hypersensitive to the presence of gluten in the foods that you eat. So this is an autoimmune condition. Pancreatitis, inflammation of the pancreas. Parotitis is the inflammation of the parotid glands. It's also another term for the mumps. So that would be the inflammation of just the parotid glands, which is an example of a salivary gland. And a general term used for the inflammation of a salivary gland is our next term, sialoidinitis. Peptic ulcer is having an ulcer or a lesion within the lining of the digestive tract. This usually occurs within either the stomach or the duodenum. Peritonitis is the inflammation of the peritoneum, which is the membrane that lines the inner abdominal wall and covers the organs within the abdomen. Polyp, this is a small growth. These are usually benign, and they tend to stick out from a mucous membrane. And when you have several polyps that are found, that is a condition called polyposis. And when you get to this point, this will usually affect how that organ is functioning. So in the case of the colon, for example, these polyps will become malignant. So polyps can, over time, develop into something cancerous. Alright, in this image we have an example of polyposis. These individual circles represent individual polyps. So the condition of having multiple locations of multiple polyps will be polyposis. And over time, these usually benign structures can become malignant and turn into cancer. So for this image here, this would be colon cancer. Proctitis, this is the inflammation of the rectum or the anus. Proctoptosis, we're going to break down that term. Procto means the rectum, and ptosis means a drooping. This would be a prolapsing or a sagging or drooping of the rectum. And our last term here, volvulus, a rolling or a twisting of the stomach or the intestine, which will lead to a obstruction. Here's an image on how that would look. We have the small intestine rolling over on itself and twisting itself, which will cause a blockage here. All right, now we'll talk about some treatments, procedures, and devices. We'll start with some word parts. We'll start with the prefixes. An means without or lacking. Anti means against. Dia means complete or through. And endo means inside. Some common combining forms. Abdomino is a reference to the abdomen. Acido is a reference to acid. For this system, usually a reference to stomach acid. Appendo is a reference to the appendix. Kilo is a reference to the lip. Cholecysto is a reference to the gallbladder. Colodoco is a reference to the common bile duct. Colo is a reference to the colon, or the large intestine. Duodeno, the duodenum, very first part of the small intestine. Esophago is a reference to the esophagus. And feco is a reference to feces. Gastro is a reference to the stomach. Gingivo is a reference to the gums. Glosso is a reference to the tongue. And ilio is a reference to the ileum, the very last part of the small intestine. Laparo is a reference to the abdomen or the abdominal wall. Litho is a reference to stone. Naso is a reference to the nose. Polypo is a reference to having polyps. Pyloro is a reference to the pylorus or the pyloric sphincter. And vago is a reference to the vagus nerve. Some common suffixes you'll see. The suffix al, pertaining to. Synthesis means the withdrawal of fluid. Ectomy means the surgical removal of. Emetic is a reference to a drug that will induce vomiting. Gram is a record or a result of a test. And the suffix graphy is the process of recording. The suffix ic means pertaining to. Plasty, the surgical repair of. Raphy is a reference to a suture. And last one here, urea, is a flow or a discharge. Scopy is a visual examination. Spasmodic is having spasms, a sudden contraction of muscles. Stomy, formation of a new opening. And suffix tomy is the process of cutting. All right, now we'll talk about some particular treatments and procedures and devices of the system. See, our first one, abdominocentesis. This is where fluid is withdrawn from the abdominal cavity. Antacid, this refers to a medicine that will correct the acidity production of the stomach. This is used to neutralize the high acid levels produced. Antiemetic, this refers to a drug that will prevent vomiting. Antispasmodic, this is a reference to a drug that will reduce or suppress the spasms of muscle. An example of that would be an antidiarrheal. Medications that are antidiarrheals will suppress the large intestine from having spasms and therefore moving material through the large intestine too quickly. And if that material moves too quickly, water can't be absorbed by the large intestine, so the stools end up being very watery. So if we slow down the activity of the large intestine, that material will move through it more slowly, giving your body the chance to absorb the water that it needs. Appendectomy, surgical removal of the appendix. Bariatric surgery, these are procedures that are performed on the intestines or on stomach in order to lose weight. Our next term, cathartic. When we talk about the digestive system, a cathartic is a medication that will help speed up bowel movements. Now, this is different from a laxative. A laxative will make these stools softer, so it's easier to pass. And our last term here, chylorrhaphy. This is a suture within a lip. So basically the repairing of a lip. So our next term, cholecystectomy, is the surgical removal of the gallbladder. Cholecystogram. This is a imaging technique, a radiograph of the gallbladder. The X-ray examination used to detect the presence of any gallstones would be our next term, cholecystography. Our next term, So if you were to break that long term down, kolodoko is a reference to the common bile duct, litho is a reference to a stone, and tome is a reference to an incision or a cutting. So kolodoko is an incision into the common bile duct in order to remove gallstones. And our next term here, colonoscopy, is a visual examination of the colon, used to detect any abnormalities or any changes within the rectum or the colon. And here's how that process would work. A long, slender tube is inserted into the rectum, and a colonoscope will be worked its way all throughout the various parts of the colon to check for any malformations or abnormalities. And you can see here, instead of being completely wide open, this part here is obstructed. A very easily observable tumor. Our next term, colectomy. This is the surgical removal of part of the colon, and sometimes this will lead to the formation of a colostomy. We have a part of the colon being redirected to an artificial opening, leading to a colostomy bag. So this is done to divert material away from an injured or impacted, an abnormal part of the colon. And when this is done, a stoma needs to be created. A stoma is a artificial opening made into a hollow organ. So this is where the bag would actually attach. The bag would be worn externally to the body, but attached to the colon through the stoma. All right, our next term, FOBT, fecal occult blood test. This is a blood test that's used on stool samples to check for occult or hidden blood. And the presence of blood within feces can indicate polyps or possible colon cancer. Gastrectomy is the surgical removal of part or perhaps all of the stomach. Gastric lavage, also known as stomach pumping or gastric irrigation. This is a process of cleansing out the contents of the stomach, usually done to eliminate poisons from the stomach. And when you want to cleanse out or flush out contents of the colon, you would use a colonic irrigation. And the way you would do this would be the injection of gas or injection of water into the rectum in order to remove the contents of the colon. And that would be an enema. So our next term, gavage. This is administering food or drugs, but by force. And the way you would do that is through a nasogastric tube, a tube that goes into the nose and down to the esophagus and into the stomach. So if you need to force feed someone because they can't eat on their own or if they are choosing not to eat on their own, a gavage would be necessary. GI endoscopy, of course GI stands for gastrointestinal. This is a visual examination of various parts of the gastrointestinal tract, and depending on what part of the tract you're looking at, it will have different names, which is what we have here for our next three terms. So our first one, esophagoscopy, will be a visual exam of the esophagus. Gastroscopy will be a visual exam of the stomach. And our last term here, esophagogastroduodenoscopy. This will be a visual exam of the esophagus, the stomach, and the duodenum, the first part of the small intestine. So all three of these are examples of endoscopies of the GI tract. It just depends on what portion of the tract are you looking at. Some other examples of GI endoscopy. Laparoscopy will be a visual examination of the abdominal wall. Colonoscopy, visual exam of the colon. Sigmoidoscopy, will be a visual exam of just the sigmoid colon. This is that very last section of the colon. Proctoscopy will be a visual exam of the rectum. Our next term, GI series. This is a reference to having radiographic examinations of various parts of the GI tract. This is done by having the patient usually drink a solution of barium. Then the patient will have a series of x-rays to basically trace where that barium goes within the GI tract. Then depending on what part of the GI tract you want to focus on, it'll have different names. The first term here, upper GI series, or UGI. The upper portion of the GI tract would include the mouth, the esophagus, the stomach, and the duodenum. And the next two terms, barium swallow or barium shake, both reference the solution that has to be taken by the patient in order for the GI series to be able to work properly. And here's how that would work. In this illustration, the patient is drinking the solution, so that would be a barium swallow. And then that solution would coat the entire length of the GI tract. Okay, other ways to inject barium into the patient for a GI series would be a barium meal or a barium enema. You would use a barium enema if you want to look at parts of the lower GI tract. So if you're looking at the lower end of the tract, you're better off injecting the barium through an enema through the rectum. So that would be a lower GI series. And this is how that would look. And of course the barium would be coating the lower part of the tract. You can see that highlighted here. Our next term, gingivectomy. This is the surgical removal of the gums, or a part of the gums. So our next term, glossorrhaphy. This is putting sutures within the tongue. Hemorrhoidectomy, surgical removal of hemorrhoids. And the last term here, herniorrhaphy, sutures within a hernia after you surgically repair it. Ileostomy. This is the creation of a colostomy, but in the ileum part of the small intestine. The ileum is the last part of the small intestine. Laparotomy is a surgical incision into the abdominal cavity, which would be related to laparoscopy, which is a visual examination of the abdominal wall and abdominal cavity. And the last term here, polypectomy, is the surgical removal of a polyp. Pyloroplasty is a surgical repair of the pylorus, which is a valve at the lower end, the distal end of the stomach. Our next term, CNS, stool culture and sensitivity, is a process of taking a sample of stool and then culturing it or growing it. So this is mainly done to detect the presence of pathogenic bacteria and to help diagnose any infections of the GI tract. Vagotomy, this is the cutting into of one of the branches of the vagus nerve. Okay, now we'll go over some common abbreviations of the digestive system. The first one, BE, barium enema. CNS, culture and sensitivity. EGD, esophagogastroduodenoscopy. FOBT, fecal occult blood test. GERD, GERD, gastroesophageal reflux disease. GI, gastrointestinal. HCC, hepatocellular carcinoma. IBD, inflammatory bowel disease. IBS, irritable bowel syndrome. LGI, lower gastrointestinal. LI, large intestine. NV, nausea and vomiting. UGI, upper gastrointestinal. Alright, we will finish our chapter on the digestive system with our combining form quiz. The terms on the left, cholecysto, gastro, cialo, stomato, and ano. This will match up with either saliva, gallbladder, stomach, anus, or mouth. So the first one, cholecysto, goes to gallbladder. Gastro goes to stomach. Cialo goes to saliva. Stomato goes to mouth. And ano goes to anus. And here are all 5 terms correctly matched to their definition. And that brings us to the end of this video on chapter number 10. We will continue our series on medical terminology with our next video on chapter number 11.